Good afternoon. If it's a little bit past 12:30, so I think we should get started. My name is Yuria Tanimichi Hoberg. I'm in the Agriculture Department of the World Bank, and I'm one of the members of the Secure Nutrition Knowledge Platform. The members of the Secure Nutrition Platform are from the Agriculture Department, the Nutrition Department, and from our Poverty Reduction and Equity Department. Jose Cuesta is here from there. So we're delighted today to be able to host a brown bag lunch on this discussion paper that came out of the Nutrition Department. I am particularly delighted because this paper was used as the main background document to a separate report that we are just about to publish from the World Bank called Improving Nutrition Through Multi-Sectoral Actions. Anna and I worked on the Agriculture Department, but this discussion paper that we're going to hear about today really was the background paper for it. I personally think that this paper sort of has the first best case scenarios, the things that you really want to do in agriculture. And then what we did for the World Bank paper was we were a little bit more operational, a little bit more practical, and we thought, okay, what can we do within the given constraints of our World Bank investment operations through the agriculture sector? So with that, I think it's a terrific opportunity for us to be able to hear from the two main authors of this report. The third author, Professor Pinstrup-Andersen, couldn't be here, but both Andy and Anna were his PhD students at Cornell, and so it was a three-author report. And you have Anna and Andy's bios in your the email invitation that you got. I'll just mention that Anna currently works as a consultant to the Nutrition Department of the World Bank, but she also works as a consultant to FAO, as well as the USAID Spring Project dealing with the Feed the Future program. And Andy is a research associate for the Division of Nutritional Sciences at Cornell, and he's consulted for the bank previously. He currently works a lot on research projects in India and Zimbabwe. So with that, I believe Anna is going to start off, and then Andy is going to conclude a team tag presentation. And I think we're trying to get the presentation about 45 minutes, and then the rest will be Q&A with the audience. So Anna, it's all yours.
Thanks, Yuria, and thank you for everyone who made it out here today. I know many of you in this audience. I know that many of you are really interested in this topic in your own work and have done work on it yourselves and have a lot of experience in it. So we thank you for coming to hear what we have to say. And, you know, if you haven't even been involved in it yourself, you've probably seen there's been many seminars, events, even symposia about this topic in recent months and the past few years. So you may be wondering, as you're sitting here today, what are we going to say that's new, that you haven't heard before? And the answer is probably not too much. So thanks for coming. Grab a cookie. We will spend a lot of time going over all those that we put together in this paper, but we actually think that it's very significant that many of the things we're going to say have been said by many others. In fact, many other people and many institutions have begun to publish on their own many of these same guiding principles that we are talking about today. And we think that this sort of convergence around some of these guiding principles, not just by us, but by many others, is really an important sign about how we can move forward on this agenda. As Yuri mentioned, we were tasked to write this paper as a background paper to the World Bank's forthcoming multi-sectoral guidance note, which has chapters on health, social protection, and poverty reduction, as well as agriculture. Clearly this informed the agriculture chapter. This work was initially supported by Mira Shaker and Leslie Elder, who were really strongly interested in how to take this kind of thinking forward at the bank. And our task was to review the evidence and to come up with some kind of statement about what could be helpful for operational planning to try to improve nutrition outcomes from agriculture, because the bank has such a substantial portfolio in agriculture, and not just the bank, but also more broadly. What can we say? And as Yuri mentioned, our co-author is Per Pinstrup-Andersen, who we obviously drew heavily on his very long and distinguished career in thinking about these issues. He's been writing and working on these issues for over 30 years, and a lot of his writing was initially what made people start thinking about these issues. Even decades ago, his writing and thinking sort of informed some of the first efforts to look at the evidence about what are the connections between agriculture and nutrition, because Per was one of the first people who was saying these connections are not automatic. So we have seen from a lot of evidence that the connections aren't automatic, but yet they're incredibly important. There's no other sector that can fully compensate for the role that agriculture has in human nutrition. So part of this great opportunity we have to work through agriculture is that agriculture is the main livelihood for the majority of nutritionally vulnerable people. 75% of the world's poor are rural. Most of those people are engaged in agriculture. About half of them are women, more nutritionally vulnerable. And of course, also agriculture produces food. And this is important not only for the people who are producing that food for their own households, but for everybody, for producers and consumers alike. And agriculture, the first thing we often think of is food, but it's not just food. Ag also affects all of the main underlying causes of malnutrition. So just to briefly, present the framework that we had in our minds that we're working from, we go back to the UNICEF Framework of the causes of nutrition or malnutrition or nutrition, however you want to frame it. And the main underlying causes here of, let's see if I can get this pointer, of food, health, and care are all strongly affected by agriculture. And these, of course, lead to the immediate determinants of nutrition, which is food and nutrient intake and health. So like I was saying, it's not just food. Agriculture affects healthy environments, environments that are free from contaminants, free from disease vectors that could be a part of especially water systems surrounding agriculture. Agricultural practices also strongly affect women's decision-making power, women's income, their time, and their knowledge, and that feeds directly into maternal and childcare practices, which affect both health and food intake. And then, of course, access to food. Agriculture strongly affects food security. And I want to point out here, I want to spend a little bit of time on food security. Because food security is so often a main primary goal of agriculture projects. Many of the first sentences of agriculture projects are to reduce food insecurity. That's the main rationale. And I just want to point out here that there's no separate bubble for food security and then nutritious food. Food security is access to nutritious food. And if you look at this definition that 182 heads of state signed onto back in 1996, food security exists when all people at all times have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for a healthy and active life. So really, when agriculture aims to affect food security, nutrition is wrapped up in that. It's about achieving consistent access to diverse, nutritious diets. That's what food security is. So what's in it for agriculture to think about nutrition? Well, it's inseparable from reduction of poverty and food insecurity. Of course, as you all know, nutrition is very closely tied to poverty. It's not just a result of poverty, it's also a cause of poverty, a cause of mortality and morbidity, low productivity. The bank has done a lot of work showing how closely related undernutrition is to losses in economic income for people and also for nations and GDP. And paying attention to nutrition removes constraints to productivity and income generation. If you're not well nourished, you're not going to be producing very well. And there's some empirical evidence from tea pickers who are anemic, who are markedly less productive than those who are well nourished. But it's not just that, it's also if you are dealing with malnutrition, if you have a sick child who is severely sick because they're malnourished, if you're dealing with that, that takes time. That takes women's time. It sucks resources away from productivity to deal with malnutrition. So having a well-nourished population is just in general good for productivity. And also thinking about nutrition automatically sort of shifts the focus towards a lens on women's income and women's time. And that deals with women's participation in agriculture, which is increasingly a goal of the agriculture sector, to have gender equity. And it's also good business because you don't want to really ignore 50% of your labor force. You want to make sure that they're fully involved, and having a nutrition lens helps to translate into gender equity in agriculture. And beyond the good business of including women, it's also the most nutrient-dense foods happen to be also very high-value foods. So increasing attention towards high-value production to meet demand for nutritious diets, increasingly in urban populations, but all over, and helping to link the vulnerable in the agriculture sector to that demand would be good business. And we know that business as usual is not sufficient. We know right now we have 870 million hungry, just lacking adequate calories. Beyond that, we have 2 billion in total who have hidden hunger, which is not just inadequate calories, but inadequate nutritious diets, micronutrient deficiencies, so not well nourished. And then we have 1 billion, actually probably more than that now, it's growing every day, who are overweight or obese. So, of course, agriculture is not solely responsible for this, but food systems have a whole lot to do with food that nourishes and maintains good health, avoiding both over and undernutrition. And we know from evidence on individual projects that nutrition impacts can be positive or negative. So again, the impact of agriculture is not just automatically good for nutrition without any thought. And we've seen from the past decades of agricultural growth, the Green Revolution, that calorie production and economic growth are not sufficient to solve nutrition problems. So here we have GDP level on the bottom, and then proportion malnourished on the side. And this just shows that stunting does go down with economic growth. But when you look at the data for agricultural economic growth, some recent analyses have shown that what you can expect is on the order of a 15 to 20% reduction in stunting based on a doubling of agricultural GDP. That actually is better than just overall economic growth. Agriculture actually does a little bit better job of being correlated with stunting reduction, but it's still very, very slow. I mean, most countries are achieving, agriculture economies are about a 5% growth a year, so very far from doubling. So if we were just going to rely on economic growth to reduce stunting, we'd have to wait for a very long time for levels to really go down. And then it's not just that, it's also, we have this other curve of obesity, which actually is also more strongly correlated with agricultural growth than general economic growth. So it's a slow change, and it's also just trading one nutritional problem for a different nutritional problem. So economic growth is really a double-edged sword, and at that, it's a blunt one to achieve nutrition goals. Fortunately, it's not the only pathway to nutrition. This report from the World Bank that came out in 2007 outlined 5 main pathways from agriculture to nutrition. And the one of them, of course, is correlated is economic growth. But the other pathways that were outlined in this report are higher food production and lower food prices as a route to nutrition. Of course, this route depends on what kind of food is becoming cheaper and more available, what kind of food is becoming less available in terms of how that affects nutrition. And then increased incomes for households. It affects home consumption that can lead to nutrition changes, and also women's empowerment, as women are directly employed in agriculture. And then nutrition education was pointed out as a kind of modifying factor for these pathways on how income and home production and women's empowerment translate into nutrition. And this is, there are other people who have outlined different numbers of pathways from ag to nutrition, but in general, these kind of capture like the main points that most everyone talks about. And these ones over here are the more household level pathways, and over here, these are more of the macroeconomic pathways. I think in the past, agricultural growth has really focused on that red side, and we know from our review of the evidence that more attention is warranted for these household level pathways on the blue side. But how do we follow these pathways? I mean, even with these 5 different pathways, the effect isn't automatic, right? So how is it that we get from inputs and activities up here in agriculture to actual impact through these pathways on nutrition? And that's what our guiding principles are about. They are not specific interventions, because specific interventions are going to vary widely by context. What works in one place is going to be different from what works well in another place. But these principles, our idea is that these are things that are broadly applicable across a wide range of circumstances, and they're principles that can be adapted through individual interventions that would be appropriate to contexts. And the nice thing about these principles is that you don't have to take our word for it. Here I want to point out this brochure that you have is a summary of an effort that FAO supported to look into all of this material that has been coming out in the past couple years, actually mostly since 2008, since the food price crisis, and look at, okay, there's been a lot of guidance on linking agriculture and nutrition. Let's look at what all the different institutions are coming out with and see, are there common messages? What is everyone saying? And when I worked on this report for FAO, we found over 50 reports mostly in the past 5 years that deal with this topic, published by about 30 institutions. So there's really a lot out there. Out of those reports, we classified 12 institutions as having guidance notes, which is sort of generally applicable guidance. Like, these are what we think is generally important, just like what Andy and Per and I were trying to do. There were the other things that were in different categories were like an institution's own strategy for how they were going to reach nutrition in their particular work. But we looked at, okay, of these 12 institutions have published, statements of, we think this is general guidance on how to reach nutrition through agriculture. And I read through all of these documents, carefully coded what was being said, and tried to boil it down into what are the main messages that are being said. And I was actually really surprised to find how much convergence there was and how much overlap. And this brochure here, these 20 principles on the back, are basically what came out of that effort to see what was being said. And it's worth noting that of these messages here, they were all said by a majority of the institutions. It wasn't just like a few of them. They were all said by usually at least 8 or 9, but many of them by all 12. So a whole lot of convergence on some key ideas. And we are going to be, throughout this presentation, relating the guiding principles in our paper to this effort to look at other institutions as well. So the first principle we have, which we are saying in our report and which absolutely everyone else said as well, is the principle of incorporating nutritional concerns into the design and implementation of agricultural investments. So including a nutrition objective as an explicit program or policy goal, so that you're actually looking at how the project is supposed to travel those pathways to get to improved nutrition, not just assuming automatic impact, but having that goal as something you're including in the project to strive for. And that has also to do with measuring nutrition. So not just having the goal, but also being accountable to it and having indicators in the project that would allow the project to keep track of what's happening regarding nutrition. And then in the FAO synthesis paper, these are the principles that relate to that were said by a majority of the other institutions. Incorporate explicit nutrition objectives, measure impact through appropriate monitoring and evaluation, and also do no harm, which has to do with monitoring and evaluation, making sure that what you're seeing is actually positive effect, because we know in the past there have been projects that have shown some actual negative effects on nutrition and diet. The second principle has to do with targeting the nutritionally vulnerable. So a lot of times agriculture projects may sort of start with a vision like this, a farm where it's easy to incorporate inputs, technology, it's sort of easy to get things going quickly and increase productivity and growth rapidly. But what is being said now, what we're saying in our paper, is that the vision might be more something like this. A small farm, smallholder farmers who are fully employed by agriculture and nutritionally vulnerable. And if we want to affect nutrition, to actually focus on these folks. And, a lot of people are talking about smallholders. There's Bill Gates saying, poor farmers are not a problem to be solved, they're a solution. We had Haven Lave a couple weeks ago here in this series talking about the Gates Foundation's approach to this issue, and smallholders are definitely a key. So the principle of targeting within populations, target poor and vulnerable households. But then also within households, there's some more targeting to do. Within households, we want to reach women of childbearing age and young children. And there's a little bit of confusion about this, because what we're not saying the project should go out and target only households that have young children. That wouldn't be realistic. We're saying that the poor households should be targeted, but then within there are things that projects can do that would then effectively target those groups. There are types of interventions that would reach young children and women a little bit better. So, in the nutrition world, there's a whole lot of advocacy around the first 1,000 days. And I know agriculturalists tend to sort of glaze over when this concept comes up. But in fact, agriculture is really, really important to this time period. And one of the ways that we can think about this sort of need to target this time period is generally the production of nutritious and diverse foods for healthy diets. That's critically important in pregnancy. It's critically important in young childhood. After children are 6 months, if they're done exclusively breastfeeding, they have to start eating healthy, nutritious foods and have those foods accessible. So this picture here of feeding a young child, agriculture can help to make sure that nutrient-rich foods are accessible. Orange flesh sweet potato is a good example of that, where impact on vitamin A status was shown partly because it's a food that can be mashed up, it can be easily fed to kids, it's something that works to actually reach that age range. And then this picture here I like because it just really brings out how, women still work in agriculture through their pregnancies, and there are things that can be done about labor in that time period, nutrition education, that time period having to do with labor and rest and adequate diets. So that's where this guidance comes from, to think about these groups within planning agricultural projects. And by a majority of other institutions, this was also a strong message: target the vulnerable, smallholders, women, food insecure and poor households were the ones that were primarily mentioned. So I'm now going to turn it over to Andy, who's going to talk about the rest of the principles.
All right. Well, I'll pick up where Anna left off here, talking about the third principle that we identified of investing in women. It's kind of a broad topic, but Anna mentioned the idea of women's empowerment as one of the guiding principles, or as one of the pathways that the World Bank identified. You can think of women's empowerment as a separate pathway, but you can also think of it as an input into or an outcome of the income pathway and the production pathway. Women, of course, play central roles in agriculture, and they're also very important for providing nutrition for their families and for their children. So it's not surprising that women are kind of a central link in linking agriculture and nutrition. So women are responsible for many aspects of agricultural production in many different contexts. They do the harvesting, they do the sowing, they do the weeding, the maintaining of crops. They can do manuring, they can even be involved with plowing. And sometimes women are exclusively responsible for some of the tasks. In my own research, working with smallholder agropastoralist farming families in the highlands of Bolivia, the women in those communities were responsible for pasturing the mixed herds of sheep and goats and llamas that nearly every family there owned. That was their cultural role. Men, by and large, did not do that. So when we were designing an intervention there, a multi-sectoral intervention around ag and nutrition, we had to take that fact into account and understand their roles as farmers and as herders in order to improve their child feeding practices, which was our primary objective. We had to do that because women are not just farmers and herders. They play multiple roles in households, not least of which is their role as sort of the nutritional gatekeepers of households. They provide care for children and for elderly household members, in addition to all kinds of other household tasks, from doing laundry and cleaning, from fetching water, fetching fuel, and providing for their own care. So there's this idea of a zero-sum game for women in low-income households has been recognized for quite some time, wherein women are responsible for earning income, for farm work, for dealing with the kids, and their increased time spent on one activity necessarily means that there's going to be trade-offs in the time spent on other activities. In poor households, more labor dedicated to agricultural production, for example, by women doesn't mean that someone else is going to pick up the slack elsewhere for caring for children or for doing other tasks in those households. So this simple cartoon doesn't even reflect sort of the domestic labor that women are involved in, their time devoted to reproduction, lactation, or even their leisure time. So time stress is a big factor here. In my own research in Bolivia, we carried out interviews with about 100 women and asking them about the barriers they face to improving their child feeding practices. And the barrier that came out at the top of that list was the time that they dedicated to pasturing their animals and to maintaining the crops. This activity, amongst all the other ones, completely shaped their day-to-day lives. Not just the amount of time they spent on it, but also the physical environments in which they found themselves out on steep mountain slopes amidst herds of animals, and that shaped their feeding environment. So if we had ignored that fact, we would have missed out on really understanding how their livelihoods as farmers shaped their ability to transform their feeding practices. So when we think about the framework that Anna showed of care and feeding, that is a primary pathway here that agriculture can influence. So investing in women becomes incredibly important. They're involved in so many aspects of agricultural production, so it's important not just for improving production, improving incomes, but also translating those gains into improved nutrition outcomes. So we think about prioritizing investments that strengthen women's control over decisions and income. Women typically spend a higher proportion of their income on health care and on food for children and for the family than do men. There's evidence of this across many, many settings. And so the distribution of income within a household becomes very important. Increasing access to time-saving and productivity-enhancing technologies, especially for women. And more generally being sensitive to their constraints. And if you're going to put another constraint on women, make sure that you're not sacrificing childcare in the process, or make sure that you're ensuring that women are able to to maintain control over production or income that results from their labor. And increasing women's access to land rights and other productive resources like knowledge, like access to credit, like access to membership in cooperatives, things like that. And this was a principle that was said by many other institutions, this idea of empowering women, equitable access to resources, maximizing household income for women, targeting appropriately, and again, doing no harm. Another big principle that we're drawing attention to here is diversification of diverse diets and ensuring diverse diets across the year. Diet diversification is a common goal in many agricultural programs that seek to improve nutrition. If you think about the homestead food production programs that are very commonly noted in this literature, whether it be growing gardens at home or rearing small animals, and we're seeing that diverse diets are very important for many different kinds of nutrition outcomes. Diet diversity is linked to dietary adequacy, the extent to which people are meeting the requirements for macronutrients and micronutrients. It's been linked to child growth. It's even used as an indicator of food security. So diet diversity is sort of this indicator of many aspects of health, nutrition, and well-being broadly. But we're seeing serious challenges, especially in sub-Saharan Africa, in diversifying diets. The higher food production is a paradigm for agricultural production in Africa. And you can see there's large disparities here in the per capita food availability by different food groups in sub-Saharan Africa, with starchy roots and cereals far outpacing the availability of pulses and fruits and vegetables. The WHO and FAO recommend about 400 grams per day consumption of fruits and vegetables to prevent chronic disease later in life. And you can see you would need to about double that in order to achieve that threshold. Pulses, only about this is only about a quarter of what you would need in order to achieve adequate protein in the diet. And this is assuming perfect distribution of this food across the population, which almost certainly is not the case. There's going to be differences across income strata. So how do we diversify diets then? One strategy might be to increase the consumption of foods that are already existing in the food system that have high contents of vitamin A or iron or zinc, these kind of problem nutrients. Another strategy might be to introduce into a food system new varieties of foods that have higher content of micronutrients. And the Harvest Plus program, which many of you are probably familiar with, takes one approach to this strategy, not introducing nutrient-rich existing varieties, but actually biofortifying staple crops with higher levels of micronutrients. But the Harvest Plus program is unique. Crop varieties are rarely chosen with respect to nutrient content. Varieties could be planted for economic reasons or for agronomic reasons, but unless you have a specific nutrition intervention in mind, you're not really going to find many programs that choose varieties based on their nutritional content. We recently looked at about 100 different foods in the Bolivian context that I mentioned to you earlier, from a sample of about 400 women. And we found that the variation we looked at vitamin A and iron, the variation of micronutrients across the food system in different kinds of foods was far greater than the variation that you would find within different varieties of a single crop. So, and if you think about it, identifying nutrient-rich crops within a food system is a fairly easy thing to do. You can look at just the color of the fruit or vegetable. You can think about, is it an animal source food or not? And that can be a very simple process if you compare it to having to go through a process of selecting a nutrient-rich variety of a crop, which may involve a much more highly informed selection process. So depending on the context and the needs, there's different ways of going about diversification. So increasing production of diverse foods, this is the principle. Improving nutritional content of foods produced. This could be through biofortification. But you need to be careful there and make sure that you're maintaining or even trying to improve the existing production diversity in those systems. Industrial fortification at the village level is another way of going about this aspect of it, or using zinc fertilizers or iodine fertilizers. Depending on the existing level of zinc in the soil, zinc fertilizers may have different effects on yield, but they have been shown to double or even triple the zinc content of cereal crops in some cases. Improving basic food safety. The low-hanging fruit with this is mycotoxins. which are toxic secondary metabolites produced by molds, and that they're usually a problem in groundnut and in maize crops in the tropics. The fungal growth is kind of proliferated by, it can happen before harvest, during harvest, or afterwards. It can happen from drought stress or excessive moisture or improper storage. And we don't know a lot about how these toxins affect nutrition in humans. There's a growing literature on that, but it has been linked to stunting and immunosuppression and even liver cancer. So there may be simple ways of going about improving the safety of crops around simple things like improving how crops are stored, which could really influence this aspect of this principle. And also decreasing the impact of seasonal food shortages, whether it be through solar drying technologies that can increase households' access to diverse foods throughout the year, introducing earlier or late season crops to allow farmers to sell their crops at more profitable times of the year. This is another part of this principle. So year-round access to diverse, safe, and nutrient-dense foods. And again, there was a lot of convergence around this principle as well. Diversifying production, increasing production of nutrient-dense foods, especially horticultural crops, bringing the production of animal source foods to scale. And you can see the other principles there that were in line with this. We also talk about water management and protecting health through water management. Water management is important for thinking about the potential nutrition and health impacts of agriculture for three reasons that we've identified. The first one is that the sustainability of water use in the long term is linked to the sustainability of ecosystem function and livelihoods. We know that agriculture already consumes about 70% of the global fresh water supply. And its water use efficiency is pretty low. You can see here a map from the IPCC. I'm talking about current vulnerabilities in fresh water resources, and they're widespread throughout Central and South Asia, Southeast Asia, Northern Africa, as well as Southern Africa, and the Andes of South America, and in the United States as well, of course. So there are a number of different kinds of water stresses. And the amount of water needed by 2050 is estimated to be 50 or 90% higher than it is today. That is because of population growth, increasing demand for livestock, depletion of groundwater stores from overpumping, and this will all be exacerbated by climate change because of higher temperatures and surface water evaporation. So thinking about the sustainability of water use is very important. And there's increasing recognition of the fact that water use efficiency is important. Dr. Daniel Hillel, shown here, won the 2012 World Food Prize for his work with drip and trickle irrigation systems that apply small but continuous amounts of water to plant roots, and showing a lot of increase in production, but also water conservation. So water conservation in agriculture is important, not just because agriculture is not the only area of life where water is important. And so the second reason why water management is important for understanding how agriculture impacts nutrition is because there are multiple competing demands for water within households and communities. Access to more water means people will use more water. We have a lot of evidence from different contexts saying that more centrally located water sources allow better access to water than further away sources. If that's the case, people use more water, and they use more water for things like hygiene. And for that reason, access to more water is associated with lower diarrheal rates, more frequent food preparation, and better child nutritional status. So another reason why water access is important here. The third consideration in all this is that poor water management can lead to increases in waterborne vector-associated diseases. So there are a lot of cases, a lot of instances where irrigation projects have been associated with contributing to increases in malaria rates, which is transmitted by mosquito, obviously. Schistosomiasis, which is a disease caused by a parasitic worm, and these snails, these water-dwelling snails, are the intermediary between the host and the agent. So a lot of dam projects have been shown to increase incidence of schistosomiasis, and other diseases like Japanese encephalitis that are also transmitted by mosquitoes. So there's the opportunity to increase the mosquito breeding pools through irrigation projects. So protecting health through water management, improving water use efficiency, and minimizing harm from waterborne diseases, and also contamination from agriculture, like pesticide runoff, for example. And this was a point of convergence amongst 10 of the 12 studies that were looked at, managing what natural resources appropriately, not just water, but also soil resources and biodiversity. So convergence on this topic as well. So that we then talk about nutrition-sensitive economic growth and how to make poverty alleviation strategies more nutrition-sensitive. We stated earlier that macroeconomic growth is one pathway to improve nutrition, but it's not sufficient. So just to give one example here of this, these data from the WHO show surprising trends in the prevalence of overweight and obesity in, quote, high stunting burden countries. Nearly a third of the countries shown here have overweight and obesity rates greater than 40%. So we see low and middle income countries with both undernutrition and overnutrition. This is not an issue for the future. It's something that's happening today. So there may be potential negative impacts if in areas where obesity is a risk, an agricultural program or a poverty alleviation program works to shift diets away from more diverse diets towards diets that are more calorically dense. This can be a real risk factor for having a negative impact where a positive impact was expected. Another aspect of this principle is that fundamental investments need to be made in rural infrastructure like roads, like water and sanitation, like power infrastructure, to make these investments more pro-poor and therefore very likely more nutrition sensitive. This has special implications for agriculture because farmers may be unwilling to start or continue growing certain kinds of foods, especially perishable foods, if they have no viable market for those foods, if the road infrastructure is so poor that there's no access to physical markets. So when designing these strategies, how do we make them more explicitly beneficial to nutrition? Well, one part of it is, like mentioned before, about enhancing the nutrition impact of income for women. We discussed that earlier. Considering this dual burden of undernutrition and obesity when considering these strategies, and also investing in services and infrastructure. So you may have a core agricultural project, but be thinking about how you can make complementary investments in, say, road infrastructure or other public infrastructure that can support the project you're working on. And this was another strategy that was, in principle, that was there was convergence on it from the other institutions. Maximizing the impact of household income for women in particular, increasing production of nutrient-dense foods, increasing policy coherence or improving policy coherence, and more equitable access to resources. So we then talk about knowledge and incentives, how to create enabling environments for nutrition by improving knowledge and incentives. There's a rich nutrition literature out there that nutrition education and behavior change promotion can improve child feeding practices, can improve child health, can improve the growth of children, and the agricultural sector can tap into this as well. Behavior change promotion can be used both towards women and men as part of agricultural projects. This can take the form of behavior change promotion for farmers to incentivize them to grow more nutritious foods, but also for consumers to actually purchase those foods and consume them. This is an example from Anna's research, and this is in Kenya or Tanzania? It's in Kenya, of marketing efforts around indigenous vegetables. So, marketing efforts are needed if farmers are going to be able to sell their nutritious foods and thus have an incentive to grow them. And there are a couple other examples that we can highlight. We've seen examples of nutrition education in the work of Harvest Plus in their efforts to promote orange flesh sweet potato. In Mozambique, program staff there use things like theater and games and songs and recipe trials to promote the consumption of orange flesh sweet potato amongst mothers and improve their child feeding practices. More recently in Uganda, the project staff for that project there, their extensionists trained hundreds of community volunteers to go out, and they worked in pairs. One was a promoter for marketing and agriculture. The other was a promoter for health and nutrition, and they worked together in pairs to promote orange flesh sweet potato. And both projects saw significant increases in the dietary intake of sweet potato. One more example I'd like to highlight is from Malawi, and a strategy used there by the Soils, Food, and Healthy Communities Project, which is a project that works with legume intercropping. And they have a strategy called Agriculture and Nutrition Discussion Groups. And what they do is they bring together subgroups of the community, women with young children and men with young children and grandmothers, and they talk about how agriculture, social, and nutrition issues work together, and they come up with a problem-solving strategy within those groups, and they bring them together and discuss that. These meetings, the researchers there have found that it has contributed to more equitable sharing of responsibilities and resources within households between men and women, both doing the agricultural work and also doing the work around child feeding and caring for children. And it's led to improvements in child feeding as a result of that. So another example of how this knowledge and incentives could work. So the idea here, again, is incorporating nutrition education to translate production and income gains into nutritional improvements. So behavior change for farmers and consumers, and thinking about how the entire family can be involved, not just women, but men, grandmothers, mothers-in-law, and revaluing the importance of childcare, child feeding, and the role of women in households. So, and this was said by a majority of others as well, the same principle. So our last guiding principle here is about working across sectors. With nutrition issues, one sector cannot address all the determinants of the problem. Nutrition has traditionally been housed within the health sector, but there are no nutrition ministries, and therefore responsibility for nutrition can become diffuse, and no one can take responsibility for it at times. So working across sectors does not mean that agricultural extension agents need to become nutrition experts. It does not mean that nurses and nutritionists have to become agronomists. But it could mean a couple things. One is that there could be more interaction between sectoral programs to achieve their ends. This could mean combining sectoral interventions, drawing upon the expertise of the different sectors, where you may have a core agricultural project, but you have contributing inputs from other sectors. This could be health inputs or social safety net inputs or inputs around child feeding that can contribute to a broader goal. And Helen Keller International's programs around homestead food production have really exemplified how you can do this. Another possibility would be establishing a nationally shared architecture around nutrition. This could be a high-level policy group or a working group that meets regularly to advise ministries on the potential nutritional consequences of different policies. One mechanism may be through national planning commissions to coordinate multi-sector activities. A successful coordination mechanism like that, though, needs to be able to create accountability within line ministries and also be able to coordinate development partners, which isn't always the case. There are experiences from Thailand and more recently from Nepal that speak to this principle. Nepal just in September came out with their multi-sectoral nutrition plan, which draws upon this idea of a nationally shared architecture, and they have 7 government ministries involved in that plan. And also increasing the capacity of government ministry staff across sectors to address malnutrition. So building on the existing capacity that is there within ministries, but also developing new capacity. Usually that means around program design, implementation, monitoring, evaluation, mobilizing resources. Those are oftentimes the areas of capacity that are weaker. And we see this same principle with convergence around this in the other documents from institutions. So multi-sectoral coordination, building capacity, and improving governance around nutrition. So you have all these principles, so which ones should you prioritize? And the answer to that question really is that it depends. Assessing context in which a project occurs is an essential aspect of developing an operational strategy. So these principles are likely to be important in all or most cases of projects, but you can and should adapt them to the local context. And we provide in the document there, we provide some key questions for each of the principles that could help in guiding that assessment, that context assessment. And it's important to note that there's no one-size-fits-all silver bullet approach. This is not a vitamin pill. These projects are quite complex, and so context becomes very important. And in the document also, we provide a sample menu of options in the appendix for if you have different nutrition objectives, what may be some actions you might want to prioritize. But all of the principles are likely to be applicable in different contexts to varying degrees. So what is needed next if we're thinking about a research agenda or an agenda for action? Well, it's important to track impact on multiple outcomes at once. The most effective programs will have assessment data on nutritional outcomes, environmental outcomes, and economic outcomes so we can understand what the trade-offs are and if there's opportunities for win-wins between these. At the same time, we need to think not just about undernutrition, but also overnutrition, obesity and overweight. And if we can capture data on both of those within the same project, that would be a very helpful next step. Designing studies to better be able to attribute impact to specific approaches. This has been a weakness in the literature thus far. This could include things like, including a counterfactual in your research design, controlling for selection bias, disaggregating data by wealth or by gender, looking at program adoption determinants, and also making sure that you have sufficient statistical power in your design to be able to actually see differences in your outcome of interest if there's a difference that exists. And that's been a real big downfall of some of the previous studies. So designing better studies. And also collecting information on costs and cost effectiveness. This is very important for facilitating planning around how to get nutrition-sensitive activities into budgets. With this point also, we should mention that, ag and rural development programs can affect nutrition from multiple pathways. So a cost effectiveness study really needs to take into account all of the plausible pathways through which a project could affect nutrition in order to get an accurate assessment of cost effectiveness. So that's something to think about with that. So just a concluding thought here. There may be a sense from sectors outside nutrition that nutrition is important, but what do we do about it? Well, it's our hope that this guidance document, these principles, I should say, will provide some answer to that question of what do we do about it. And the synthesis study that Anna conducted and the agreement we see around these principles, using the experience and evidence of many different people, should also provide some sense of what do we do about it. Do we need more evidence? Yes, we need more evidence. But we need more evidence to understand how to better design projects, how to better implement them to get the objectives that we need to actually measure what we're hoping to change. At the same time, it's our thought that the existing knowledge that we have supporting the recommended principles here is sufficient to move ahead with nutrition-sensitive agricultural programming. Is our knowledge perfect? It's not perfect, but it's sufficient to move ahead with it, given this broad convergence we see around these principles from many different institutions. And just as a final thought here, there are intermediate outcomes of interest like improved diets and water access, women's status, that are positive and nutritionally relevant impacts in and of themselves. And even if a project is not able to show a measurable impact on, say, nutritional status, child stunting, for example, which is a downstream outcome, but it shows impact on these intermediate outcomes, those are nutritionally relevant impacts in and of themselves. And especially in the short term, that may be an indication that the project is succeeding. So that's another thing to think about when we think about these projects. So with that, we'll end and can have some questions. Thanks.
Thank you very much, Andy, and thank you also, Anna. Since you guys stayed right on time, we have about 30 minutes for questions and answers. If I may abuse my position, if I can just ask my first question. I think your presentation and our approach has kind of assumed that, or I guess it was assumed that if we were to work through the agriculture sector, what are the considerations? So I guess I'd like to sort of take a step back. And if I were in the Ministry of Finance of some country and I realized that the nutrition status was bad and I wanted to do something about it, what is your thought? What are your thoughts on going about determining whether it should be done through the agriculture sector, should be done through the health sector, through the education sector? What are your thoughts on that was my question. So maybe we collect about 3 questions at a time, and then we throw it back to Anna and Andy. So before you start, please tell us who you are and where you're from. Oh, Nancy, go ahead. And I think we're filming this, right? So you have to talk from a mic.
Hi, I'm Nancy Morgan from FAO, FAO's liaison to the bank, and this is a really interesting presentation. And my question goes back to something that Anna said that I think that we're really struggling with. And you have these guiding principles, but you said do no harm, and they're exactly, we really need information about where harm has been done. And I think in a funny way that guides us in a different way, a more constructive way. And I know Joyce Turk is here, and she works on livestock. I work on livestock, and you look at promoting dairy as a way of marketing and integration from dairy, but in a funny way, you do that, and then you have less milk sometimes at the household level. That has implications on food security and nutrition. So my question is, are you documenting, working with people to document where interventions have had an adverse impact on nutrition?
Yeah, my name is Omar Dari from Africa. I like the presentation because you make a very nice summary of many things that are around. But the presentation also points me to a specific thing that's a philosophical one that probably deserves a little more attention. I'm coming from a developing country, from Guatemala, and I was working there. I was saying sometimes the people comes to teach us how to systematize our poverty. We don't want to do that. We want to progress. And then this is a big switch between going to focus on the smallholders instead of technology. That means that the Western civilization is not an example to imitate, because they never thought in that when they created the economical growth that has improved the United States and Europe. I would like to receive a comment on that.
Stephen, and then we'll go back to Andy and Anna.
Stephen Schoenberger from the Africa region of the World Bank. I mean, I'm glad it's recorded, because this is what I'd like to send to all my colleagues, because this is the clearest, most sort of consumable presentation I've seen of this, and it's comprehensive. One thing I noticed, though, and maybe it's a consequence of the people who have put out these guidelines, is that the policy side is really light in this. And I'm curious, from your professional understanding as well as your review of this, is that because the policy element is not that important relative to these other areas, or is it just sort of an underexplored area in all of this? Because it really is barely there. And certainly there's no specifics that come out of your presentation.
All right. Wow, these are all really, really good questions. It's going to take us a while to answer them. All right, we'll just start in order, I guess. And with Yuria's question of where do we start if we're looking at nutrition as a problem, like where's the best bang for our buck, right? I think it's really not a question of which ministry do we start with. I mean, from our perspective, it's really all of them, because when you look at the causes of malnutrition, it's implicated through all different sectors, through the health sector, the agriculture sector, if there's a social protection or poverty reduction, they all have to do with it. So choosing one really it'll get you somewhere, but it won't solve the multiple determinants that operate together. We should mention the SUN movement and the framework, the SUN framework, which came out a couple years ago, and a lot of people have really rallied around the SUN movement and advocated for the ideas there. The SUN movement really has two sides. It advocates very, very strongly for nutrition-specific interventions on, things that it came out of the Lancet series in 2008 on undernutrition, very specific evidence-based interventions such as vitamin A supplementation, such as promotion of breastfeeding and supplementary feeding of children who are malnourished, things that are going to affect that very top level of immediate causes of malnutrition. And those are incredibly important. I mean, we absolutely have to invest there. It's been shown that saves lives. So certainly ministers of finance should be investing in nutrition-specific interventions. But at the same time, the SUN movement really also rallies around nutrition-sensitive work and recognizes strongly that those nutrition-specific approaches are just really going to be a short-term solution. And if we want to do anything to address the broader context, we have to work through different sectors. And the SUN framework mentions agriculture and food security first and foremost of multi-sectoral work. And just also considering not only undernutrition, but also the overnutrition side, really it comes very, very strongly to food and food production. And so certainly, if I were a Minister of Finance, I would want to be looking strongly at health sector and nutrition-specific interventions, and also very strongly at agriculture, food system interventions. I think that also speaks to Steve's question on policy. And we did, in this FAO synthesis report also, one of the conclusions that received a whole lot of comments, and policy is light, and it's definitely not because policy is not important. One of the big reasons policy is light is because what we're trying to do, and what a lot of other people are trying to do, is be evidence-based, and a lot of the evidence comes from small-scale interventions, and that leads us to programmatic solutions. So if that's where the evidence base is, we can say a lot about that. And I think that's why you find a lot of the guidance very program heavy, because there's a lot we can do within programs. But absolutely, we cannot forget policy. I mean, Per would be the first person to say that, that policy and has, you know, the effects of food policy, they really affect the whole system, and it's a much bigger effect than individual small programs. It's a lot harder to study. It's a lot harder to pin down, like, you know, what is the evidence we're looking for that, and what can we say about it. But, you know, we do have some policy suggestions sprinkled throughout. I agree that it's an area that we certainly need more development, but it's an area that is probably even more important than small programs. All right, yeah.
Yeah, I agree with what Anna said about the point you're. I just think that as well. The idea with these principles is not to necessarily say that any one sector is going to be the best sector to implement a nutrition intervention through. I think the idea is that we're going to maintain these direct nutrition interventions that Anna mentioned, mostly through the health sector. But then this is about the agricultural sector, but you can say it for a lot of other sectors. They will keep on doing their work in their sector. The idea being, how do we make sure that the work that they are doing is doing no harm to nutrition as a first step, but hopefully we can do better than that and make sure there's convergence with the work that they're doing and the other sectors. So, you know, these sectors will not be transformed into doing nutrition work primarily. They'll be doing water and sanitation work. They'll be doing agricultural work. They'll be doing education, et cetera. So how do we make, you know, bring these principles to bear to sort of guide their investments so that they can have a positive impact on nutrition, or at the very least no negative impact. And regarding the policy question, yeah, exactly, Anna, exactly. I think there, you know, throughout the document, actually, there's some more things said about policy, but it is much lighter than the programmatic stuff. I also think that it's difficult to think about guiding principles for the policy folks as well as for people working in programs. It seems like very different tasks that they have to work with, very different toolboxes that they have to work with. So thinking about how principles may guide programs, those same principles may be irrelevant or, you know, not specific enough for a policy context. So I think that was difficult to sort of speak to both audiences there, though we do have some of that in the guidance note.
Yeah, and our task was really to speak to program managers, so that's another reason. But that also makes me think of that actually, even though that our task was to speak to program managers and to look programmatically, a lot of these principles actually can be sort of translated to policy relevant principles. So for example, producing more diverse foods, that's something that is very highly influenced by policy. Incentives or barriers, you know, for what kind of production is supported through extension and through pricing and through infrastructure. And so there's certainly policy relevant messages that come out of that principle. Do you want to address the
maybe we should. Yeah, we can talk about the adverse effects. You know, there are around in the water management issue. There have been documented adverse effects, as I mentioned, of irrigation schemes and of you know, dam building projects that have. You can imagine those kinds of schemes that are sort of transformative of the local environment seem to have the biggest potential to have a negative effect because of how deeply they change things. So, you know, dam projects that flood areas and that create new vectors for snails, for example, or new breeding grounds for mosquitoes can have a large impact. And that doesn't like if you have more breeding ground for mosquitoes, it doesn't necessarily mean you're going to have more malaria. If you have complementary inputs into things like bed nets or into raising incomes or more access to health services, that could offset that. But when you have transforming interventions like that, that can be very detrimental, and that's been documented. There's also a large literature that was in the 1980s and early 1990s around the commercialization of agriculture, and I think those studies began thinking about shifting from subsistence production to cash crop production, and we saw that in many cases there were detrimental effects to the local communities. It wasn't just about nutrition did not improve in kids. That was sort of a foundational finding of those years of studies. And we need to do more than just raise incomes, which has been a kind of you hear that a lot nowadays. It wasn't just that, but it was about the fact that dietary patterns were shifting away from previously more diverse diets to more diets that were more either calorically dense or less nutrient dense. It shifted livelihoods, and so people were sort of in some cases were no longer able to depend on any kind of subsistence agriculture. They were fully dependent on wage labor. There was no balance anymore. So it shifted the balance away from having some wages and some of your own production. It was all wages, and so they were more dependent, more vulnerable in that regard. So there have been documented impacts on the livelihoods because of these projects. And I think also the diversity of diets as a result of them. I don't know of studies more recently that have looked at adverse effects or documented adverse effects. But I know there's a large chunk of literature historically that has seen that, and I hope maybe we haven't seen it because we're building from those lessons.
And that's why one of the recommendations is, just as you said, to document any adverse effects and look at doing no harm through monitoring and evaluation. I think some of what Andy was saying also starts to speak to your question about, you said, shifting the focus to smallholders instead of technology. I think we would look at it slightly differently. We would look at technology development that's targeted to the needs of smallholders. So I think some of the adverse effects Andy was talking about came from examples where interventions weren't well targeted enough to the context that smallholders lived in. So technologies that are perfectly fine in Iowa, things can't be maintained necessarily if you're living in a completely different context and you have a much smaller farm and you don't have access to repair certain things that break, or you don't necessarily have credit to keep using on inputs that would be required. So it's sort of, technology is really important for smallholders just as well as large farmers, but it's sort of the kind of technology, and is it appropriate to the context? Does it support livelihoods in the market environment, in the physical environment, in the environment of credit and resources that smallholders have to operate within?
Can I take more questions? Is that okay? Okay. More questions? I think I see a hand in the back. Please come to a mic and introduce yourself, please.
Hello, my name is Cecilia Gonzalez, and I work for an organization called World Relief in just helping with programs in Haiti and some technical support. My question is, first of all, I have a couple of questions for the audience just to, I guess, give some context. Raise your hand if you are, you consider yourself an agriculturalist. Okay. Raise your hand if you grew up in a rural village in this global south. Nice. So we were actually kind of classmates at Cornell a few years ago, and I'm a food scientist, and I went to school in an agricultural college in Honduras. And so just by the design of the program, we were very involved in all of these different issues, but we were trained in business and just to think about how does the small farmer think. And in just being involved in these conversations, I've always noticed that there is this talk about the multi-sectoral need but then I've always kind of seen a lack of maybe being able to understand each other. And it's very interesting to see how people who are very specialized have a hard time talking to somebody who is from a different specialty. So my question is, how do you get people who actually are able to understand their context a little better and maybe take these nutritional concepts, for example, into their agriculture or into their own context? Because from my experience living in the US for many years, I see that it is difficult for people who don't really understand a context, like how do people live in the rural villages, or for somebody that maybe doesn't have any idea of how a small farmer thinks, to really put in practice these concepts. So is there any more work in really getting involved people from these contexts where it actually affects them at that kind of at these high level meetings or these high level conversations?
Thank you. Any other? Please come to the mic, please. And then Jose next.
I am Carla Mejia. I work for U.S. Pharmacopoeia. That's an organization that, among other things, we set standards for food ingredients and build analytical capacity, mainly for institutional laboratories. And what I have seen so far is that the things that people ask to us is to basically build capacity on different things than before. So now there are more requests for tests against nutritional labeling, more tests for standards for food safety, water safety, and everything focused on a consumer that is mostly in peri-urban areas and urban areas. So, and at the same time, analyticals that focus on kind of making sure that whatever the private sector is saying they're doing is okay in terms of nutritional labeling mostly. So that made me think that whether you, and I wonder whether you came around or about information that relates the educational portion from the public sector in a comparison of the educational or outreach efforts by the private sector. Because you see so many programs now from the private sector that focus on better nutrition. And we all know from the US unfortunate case that the nutrition from the private sector was not the best case scenario, to say the least. So I wonder if you came across that information, because now we see that the health ministries are actually requesting that from us.
Okay. Jose, did you have a question?
I'm Jose Cuesta. I work for the poverty reduction department here at the bank. I would like to pick up again on the issue of evidence that you mentioned in your presentation. You said on the one hand, obviously, that there are problems of attribution and more studies need to be done to sort of understand that attribution. But also at the end, you concluded that there is sufficient evidence to push forward this agenda. Not that I'm questioning the guidelines. I'm just wondering what is the quality of the evidence we have? Not just how much information we have, but how good is the information we have and how conclusive is the evidence we have.
Can I go back to the panel? Was there another urgent question? Did you have a question? Go ahead.
Okay. Hi, Jennifer Burns from Counterpart International. Thank you for your presentation. I'm on the programmatic side, and I appreciate your perspective on this. And I would really like to walk away with a few more ideas of these tools that exist out there to use when you are integrating your ag and your nutrition activities. I'll leave you with one example. In Niger, we are integrating our growth monitoring promotion and nutrition education activities in the community with our community gardens. Women have little access to land, so we found one of our approaches is to group them so that women would work on one community garden together. That lessens their time spent in the garden, and they can rotate, sharing the responsibility, and then also sharing in the benefit of the produce of what they grow. But I'd like to have an idea of some of the tools that we can use as we start working with both the male and female producers to get the ones that are more oriented toward the ag side to understand the nutrition side. You mentioned homestead gardens, and I am excited to get to know this better. We're going to be collaborating with HKI to use it in the context of Niger, but I want to think beyond that. What are some of the other tools that exist out there? Thank you.
Okay, so we've got 10 more minutes, so all to you, Andy and Anna.
So another set of great questions. Well, I'll just maybe pick up on the tools right away, because I think it relates to Cecilia's question on how the different sectors can better understand each other, and different parties can also better understand each other. There's a couple that I think we mentioned in the report. Our good friend and colleague Emily Levitt did some research in Afghanistan about how health and ag workers weren't necessarily working together towards the problem of malnutrition, partly because they didn't have a shared understanding of the causes of malnutrition. So some of her work highlighted how just getting people together and these the people who were involved in Afghanistan, in her case, getting them together to talk about the causes of malnutrition and sort of develop a shared framework together of what actually is causing the problem and what can we each do in our respective roles to solve that problem was very helpful. And in her work, I know that she went back to the UNICEF framework that we covered with food, health, and care as sort of tools of understanding what are the causes in this context of nutrition problems. And Nancy, you're probably very familiar with the FAO tool, the problem solution tree, which has also been used in many workshops to bring together different groups to discuss together what are the problems and then what are the solutions we can come up with. And it's a great tool because it's very it's automatically context specific, because people are talking about what are the problems here, what are the solutions that we can actually do. So that's one tool I'd recommend to look into. And there are others to increase participation, Cecilia, like you mentioned, of the people who are actually involved, the smallholders themselves, participation, making sure that women and men are participating and representing their households. One tool I think we also mention is the use of positive deviance and looking within communities for among people who have similar resources where people actually manage to do better in terms of their diets or their nutrition, and what is it that they're doing or knowing that's different from the rest of the community, and then trying to build on that for designing some parts of intervention. So that's another possible tool. Did you have more to contribute on that?
I think I wanted to mention, but didn't earlier in the presentation, about the nutritional impact assessments that have been kind of talked about. The Infant and Young Child Nutrition Project have developed a lot of tools around going in, like an environmental impact assessment, doing a nutritional impact assessment, understanding, what's going on in the context here. How could different actions that we take affect nutrition positively or negatively in different aspects? And that's just one more tool that comes to mind there. There's a tool by Gain as well you mentioned, right, around value chains and trying to assess value chains for nutritional different objectives.
Right. I don't think that's public yet, but I know it's coming out. Gain has developed a tool with USAID for value chain selection or crop selection, taking into consideration nutrition.
Can I just put a plug and say, I believe we are hosting their launch of this tool February 28th in
Perfect.
DC.
Thanks. There was another question on information and education and how that could relate to the private sector. I think that's a really important question. And
the conference is about to end.
Oh, we better hurry. So I think when we talk about private sector, we have to think what kind of private sector, and a lot of times what immediately jumps to mind is like Pepsi, Unilever, but that doesn't represent the private sector in its entirety. For my dissertation work, which there were some slides up there, it was working with farmers in Kenya and Tanzania on traditional African vegetables. The private sector was actually a huge part of that promotion because they weren't going to be motivated to grow them at very large extent if it was just for their home consumption. They might have grown a few of them, but this was really to try to increase incomes, especially these vegetables were women-controlled crops. And it also, double burden of overweight and undernutrition is huge in Kenya, growing in Tanzania. So since these farmers were fairly close to Nairobi, it also had to do with marketing healthy foods and traditional heritage foods to consumers. And so that project worked very closely with major supermarket chains in Nairobi and partnering with them on how to transmit that nutrition education so that it wasn't just to the farmers, that it was also getting to the consumers and growing the markets for those nutritious food products that smallholders could then partner with these supermarkets who had special arrangements with cooperatives of smallholders. And this project was run by Farm Concern International, who's still doing this work in East Africa. So I think there's a strong role for the private sector in that way of, being for farmers to gain income and for consumers to get better nutrition and making sure to provide that information to both sides. If you want to say more about that. Yeah.
I guess we'll work back to Cecilia. I wanted to address just before the conference is over the issue of evidence and how substantial is it, what is the quality of the evidence. The last point we made here was the idea that intermediate outcomes are important in and of themselves. If you look at the literature, most of the interventions that are out there, as Anna said, are done on a small scale in programmatic settings, and most of them have not shown that by introducing home gardens or by introducing livestock or by working with aquaculture or whatever the project may have been, that there was a substantial impact on the growth of young children or on BMI, for example, things like that. But in almost all cases, they showed impact on diets. And if you look at homestead food production projects, there's almost always substantial increases in the amounts of fruits and vegetables that are being consumed by families. And there are shifts in sort of the dietary adequacy of families that are involved in these projects. That comes across clearly. Now, if you look at all the reviews that have been out there in the literature recently, they come down to this idea that these projects have not been designed adequately to really attribute causality to the findings that they have because they lack a control group, because they're underpowered, because they don't adequately control for selection bias and things like that. So that is something we're saying, yes, we need more evidence. But the fact that there's been sort of a consistent trend, and especially around diets and how these programs affect diets, we're saying there's that in and of itself, and the fact that the experience, there's empirical evidence in the literature, there's also programmatic experience, which I think we maybe tend to undervalue sometimes. That also comes to bear in making decisions about, is it time to take action, or do we need to wait and keep waiting for more and more evidence to accrue? And I think that's where we're saying we can take action now. Let's design better programs. Let's generate better evidence, but let's take action now. And I think one of the things that we're thinking about is that coming from the nutrition field, the field historically based in medical research, where randomized controlled trials are king. I don't think that randomized controlled trials are the future of agriculture and nutrition projects. Randomized controlled trials are great for assessing, for being internally valid and attributing causality along causal pathways that are relatively very short. Give them drug X or pill X and you get this outcome. They have very low external validity or generalizability. And in projects such as this, where we're saying, context assessment is very important, those kinds of trials say very little about context. And